Dr. Yagnik, and I'll be taking care of you today.
I'm Connor, nice to meet you.
Nice to meet you. So what brings you in today?
I've been having some heel pain on my left foot.
Oh no, okay, so could you point to exactly where?
Yeah, like right in this area, I would say.
Okay, so when did this begin?
Maybe about a month ago.
A month ago, okay. And is there a certain time of the day when it hurts the most?
I would say right in the morning.
Right in the morning, okay. And how long does the pain usually last for?
Maybe about up to an hour.
Up to an hour, okay. And could you describe the pain for me? Like, is it sharp, stabbing, shooting? What kind of pain it is?
It's like stabbing and shooting.
Okay. And is there anything you do to help alleviate the pain or make you feel better?
I just ice it sometimes and take some ibuprofen.
Okay. And is there anything that makes the pain worse?
Yeah, I run marathons and that kills my foot.
Okay. On a scale of 0 to 10, 0 being no pain at all and 10 being unbearable, how would you rate it?
I'd say about 4.
About a 4? Okay. So I'm just going to go ahead and ask you a couple of questions and then we'll get started with the physical exam. Have you had any recent hospitalizations, surgeries, or blood transfusions?
None.
None? Okay. Did you have any illnesses as a child, like chickenpox?
Yeah, I had chicken pox.
You had chickenpox? Okay. What about as an adult?
None.
None? Okay. Are you up to date on all your current immunizations?
I am.
Did you get your flu shot this year?
I did.
Good. Are you on any medications?
Just the ibuprofen and then Claritin for allergies.
Okay, and just seasonal allergies, or
Yeah.
Are you allergic to anything?
Nothing else.
Nothing? Okay. I'm just going to ask you a few personal questions and then we're done with all the questions. Are you married?
I am.
Okay. Do you smoke, take any illicit drugs, or drink alcohol?
I drink alcohol.
How many glasses a week do you think?
Maybe 3 or 4.
Okay. Are you working or are you a student?
I'm a medical student.
Okay, so how does that affect your sleep cycle?
It's tough to get to sleep.
How many hours of the night do you think you get?
I would say maybe 4 to 5.
Yikes, okay. And how's your exercise and diet?
It's good. I have to stay in pretty good shape for the marathons.
Okay, that's good. Do you have any pets?
I do not.
And do you travel or have you traveled recently anywhere outside of the country?
I have.
No? Okay, and this last question just pertains to mom, dad, brother, sister, grandpa, grandma. Do you have any family history of cancer, diabetes, any major illnesses?
Yeah, so my mom's mom had diabetes and my dad's dad had a heart attack.
Okay. Okay, so that's all for that, and we're gonna get started the physical portion of the exam. If you don't mind just scooching back on the table for me.
Oh, sure.
Thank you. The first thing we're gonna do is a vascular exam. I'm just gonna check your pulses. You have 3 major pulses, the dorsalis pedis, the posterior tibial, and the popliteal. I'm just gonna make sure that they are nice and strong. And the dorsalis pedis is present bilaterally, so I'd give that a 2 out of 4. Posterior tibial right behind the medial malleoli. That is present bilaterally as well, so I'd give that a 2 out of 4. I'm gonna go ahead and check your popliteal. This might feel a little rough. Give that a 2 out of 4 as well. I'm gonna check this one. And I'd give that a 2 out of 4 as well. Okay, that's good. So now I'm just gonna feel for temperature, make sure that there's consistency and warm to warm on both legs, and that's great. It is, so that's good. I'm gonna check for normal hair growth on your feet and on your toes, which I see normal hair growth, so good circulation. What I'm going to do now is just push down on all your toes, making sure that they go from that whitish color back to your normal skin tone within the 3 seconds, and they do, so that shows good circulation. And I'm just going to give you a little pinch to make sure that the turgor and elasticity is present. So this just shows that you have good blood circulation all throughout your lower extremities. The next thing I'm going to do is the dermatological exam. I'm just going to feel for any bumps, lesions, any open wounds, ulcers, and check the plantar surface of your foot, the underside of your leg. I'm going to do the same thing on this leg. Check for bumps, lesions, ulcers, any open wounds. All good. And now what I'm going to do is just check for any macerations in between your toes, making sure I don't see any of that. And that's all clear. And the last thing is just checking for any signs of fungi on your nails, and they seem pretty healthy, nice and strong, no signs of fungi on the nails. So that's excellent. is a musculoskeletal exam. And basically, right now I'm just checking for muscle strength. If you don't mind just pushing against my hands. Good. Push forward. Good. Pull up. Good. And push in. Good. Okay, that's great. And now I'm going to do the range of motion exam. I'm just going to make sure that all your joints are moving and you have no signs, no creaks, no cracks, no pain. I'm going to do the same thing here. And you let me know if anything bothers you. Okay, good. So those are moving fine. And now what I'm going to do is the silver scored exam. I'm just checking for any signs of equinus or any pain. So if I'm just going to put your foot in neutral position and just relax for me. I'm just going to give you a little push. Good. And then if you don't mind just lifting your leg, thank you. I'm going to do the same thing with your foot in neutral position. Good. So dorsiflexion amount is normal. I'm going to do the same thing on this leg. Put your foot in neutral position. And I know this foot bothers you, so you let me know if it hurts. Does that bother you?
Yeah, it
Okay.
hurts a little bit.
Okay, now I'm going to do the same thing. Does that, okay. So I'll make note of that. That's all for that. And the last thing I'm going to do is the neurological exam. This is the Sims-Weinstein monofilament test. And it's just a little brush. It's not going to hurt. I'm going to poke you in 10 different spots, and you let me know when you feel it with your eyes closed.
All right.
Okay.
Yes. 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 Yes.
Good. The same thing on this foot now.
Yes. 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 Yes.
Great. Okay. Now again, with your eyes closed, I'm going to poke you with 2 different objects, and you let me know if you feel sharp or dull with your eyes shut. Thank you.
Dull. Dull. Sharp. Dull. Sharp.
Okay, good. So that's that. And the next thing I'm going to do is the proprioception exam. I'm just going to push down on one of your toes, or push down or push up. So you let me know which toe I'm touching, and if I'm pushing it up or if I'm pushing it down.
Big toe down. 5th toe up. Big toe down.
Okay, good. Now this is just a vibratory hammer. I'm just going to hit several landmarks on your feet with it, and you let me know when you feel the buzz. If you could close your eyes, please. Thank you.
Yes. 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 Yes.
Good. Okay. And the last thing I'm going to do is just check your reflexes. You have 3 major ones that we're going to do today: the Babinski, the patella tendon, and the Achilles tendon. So the Babinski one, I'm just checking for any upper motor neuron diseases and making sure you have no metatarsal splay. No signs of that, so that's good. No signs. Okay. And now, if you don't mind just scooching down on the table for me, I'm going to do your patella tendon. Good. Good. And now I'm going to do your Achilles tendon. Good. Good. Okay, so your reflexes look great. That's all for the exams. So I noticed, if you don't mind scooching back, I noticed that you had limited dorsiflexion and pain right here when I was performing the silver scored exam. So it seems to me like you have plantar fasciitis. For right now, I think conservative care is probably the best way to go. I'll give you a handout with several stretches that you can go through. And what I'd also recommend is just getting a little ball and just rolling your foot along the ball for now. And I'll give you some ibuprofen that you can take that'll help with the pain relief. And for now, we'll do that. And if it still bothers you, I'll give you maybe like orthotics, or we can do a steroid shot. We'll think about all that. But for now, we're going to stick with conservative treatment. And we'll have you back in the clinic in 2 weeks. Do you have any questions?
Nope, no
No,
questions.
no questions? Okay, that's all for today then. Very nice meeting you.
Nice to meet you too.